The arrival of the 5G network promises to improve connectivity. What that means, in reality, is wider coverage and more bandwidth to allow our multitude of data to travel from A to B. To build out networks at the higher end of the RF-EMF spectrum, new base stations, or small cells, will appear around the globe. The reason behind this is that high-frequency radio waves have a shorter range than lower-frequency waves. Small cells that will allow data to travel relatively short distances will form a key part of the 5G network, particularly in areas of dense network usage. But while our lives may be transformed by faster browsing, integrated e-health applications, driverless cars, and real-life connectivity across the Internet of Things, will this make a significant impact on the amounts of RF-EMFs that we are exposed to? The short answer is, no one really knows, yet. Writing in Frontiers in Public Health earlier this month, a group of international scientists, including Drive Hardle, comment on the potential risks of 5G technology. Higher frequency, shorter wavelength radiation associated with 5G does not penetrate the body as deeply as frequencies from older technologies, although its effects may be systemic, they explain. The range and magnitude of potential impacts of 5G technologies are under-researched, although important biological outcomes have been reported with millimeter wavelength exposure. These include oxidative stress and altered gene expression, effects on skin, and systemic effects, such as on immune function, the authors continue. The teams make several recommendations, which include more rigorous testing and collecting data to identify links between RF-EMF exposure and health outcomes, sharing health risk information with users, and limiting exposure in under 16s. The last point on their list states the following. Cell towers should be distanced from homes, daycare centers, schools, and places frequented by pregnant women, men who wish to father healthy children, and the young. The bottom line. There is certainly evidence that ties RF-EMF exposure to a small increase in the risk of developing certain cancers and other adverse health outcomes. But the jury is still out on how serious a threat RF-EMFs in general, and 5G bandwidths in particular, pose to our health. For those of us who live in densely populated areas, there is no escape from the myriad radio waves zipping through the air all around us. To reduce our exposure to RF-EMFs, the Food and Drug Administration, FDA, suggests cutting down how much time we spend on our cell phones, as well as using speaker mode or a hands-free kit to create more distance between our devices and our heads. The American Academy of Pediatrics, AAP, recommend limiting the time that kids and teenagers spend on mobile devices.